Here's a tip to help you get ready. So let's talk a little bit about allergies and anaphylaxis. Lots of people have allergies, to dust or ragweed, pollen in the air, cat and dog hair and things like that. And when you have an allergy to something, histamines get released in your body. And histamines make our cells leaky. We have millions of cells in our body, little cells, and they're all made up of water, basically. And when the histamines get released, those cell membranes become leaky and water starts leaking out. Well, the water goes to our lips and our tongue and our mouth and our throat and our windpipe, and it makes our breathing a little more difficult. So sometimes people start to feel wheezy. So if they're having a histamine release, what do? They take an antihistamine, like Benadryl, Claritin, Allegra, some of these kinds of drugs, over-the-counter drugs from the pharmacies. They take about 10, 15, 20 minutes to kick in, but what it does is stops the leaking, and therefore it takes away some of the swelling, it slows it down, and it lets you breathe a lot easier. Now, if you're having a severe, life-threatening allergic reaction, or anaphylaxis, or what's called anaphylactic shock, then you're not having a little histamine release, you're having a massive histamine release. And you can't use the over-the-counter ones. They don't work fast enough. You need pure adrenaline, or what's called epinephrine. It's a naturally occurring substance in our body, but we create these things called EpiPens, and we can inject the adrenaline right into the person. The adrenaline basically counteracts the complete effect of the histamines. It stops the leaking, it stops the swelling, it reduces blood vessels, it widens your windpipe so you can instantly start to get air in quicker and easier and find relief. It takes only a few seconds for the adrenaline to actually start to work. It comes in what's typically called an EpiPen. And epi for epinephrine, and pen because it's as easy to use as a pen. You simply take off the blue cap that's on it, you jab it into the thigh. It's called an intramuscular needle or an IM needle. The needle's only this long. It's really short, super thin. Most people, when they get an EpiPen injection, they don't even feel the needle. They feel the hit of the EpiPen into their muscle. And when you, as the administrator, feel that click or pop, you'll hear it, then that fired the spring and the medicine went into the patient. And you know what? It works really, really well. So if you think you have severe allergic reactions, get an EpiPen. If you need to help someone, help them take an EpiPen. Call 911. It might get worse. They might need another one and they might have to go to the hospital. Okay? Thanks. If you've enjoyed this content, please check out the Ready First Aid app. Go to readyfirstaid.com.